Welcome to Animal Care Training Programs. In this program entitled Practical Radiology, you will be introduced to many aspects of the fascinating world of radiology. Over the next 20 minutes, you will learn the following: a practical overview of where X-rays originate, how to safely work around these invisible rays. You'll become familiar with the X-ray machine and how to set its various components, basic animal positioning, the darkroom and developing films, and finally, the proper marking and storing of X-ray films. After watching this video and completing the corresponding outline and review questions, you will be on your way to a practical understanding of veterinary radiology so that you can safely and effectively assist the veterinarian in taking and developing high-quality radiographs. The mystery of the X-ray was not discovered until 1895. A physicist by the name of Röntgen discovered that by passing electricity through a cathode tube, a mysterious form of light energy was emitted that would pass through certain materials like wood and flesh. This same mysterious energy would not penetrate other materials such as metal and bone. He could pass these newly discovered rays through objects and capture them on photographic film. Röntgen's discovery of X-rays opened the door to modern-day veterinary radiology. Today, we utilize X-rays to help visualize changes within the body that would not be possible otherwise. Utilizing the same principles, today's X-ray machines safely produce a well-defined beam of X-rays. X-rays allow us to see within the body, possibly eliminating the need for more invasive procedures like surgery. Other imaging devices such as the ultrasound machine have since been developed and are currently in use in veterinary medicine, but will not be addressed in this program. Working around the X-ray has certain dangers inherent to it if not managed properly. Repeated, unprotected exposures have been shown to produce birth defects, a decrease in fertility, an increased risk of cancer, or a shortened lifespan. These hazards can be nearly completely prevented if you follow the appropriate safety precautions. Because of these risks, however, you must be at least 18 years of age to work around radiation equipment. When X-rays strike a hard surface such as bone, there are a number of photons that will ricochet in all directions. These deflected photons are called scatter radiation. Fortunately, this low-level radiation is stopped by protective lead clothing and lead-lined walls. Lead aprons and gloves are worn to shield the vital organs and hands from repeated X-ray exposure. Thyroid shields and leaded eyeglasses are also used in some facilities to limit radiation to the very sensitive thyroid gland in the neck. The best way to limit the body's exposure to X-rays is to keep arms, hands, and head out of the immediate X-ray beam when the exposure is occurring. The farther you stay from the primary beam, the safer. The location of this primary beam is made obvious by a white light. A special device called a collimator is attached to the X-ray tube that limits the X-ray beam to a very limited, defined area. This collimator is adjustable to accommodate various film sizes and animal sizes. It is always to our advantage to adjust the collimator to achieve the smallest beam possible for what we are attempting to X-ray. For your safety, scatter radiation is measured and monitored by wearing a film badge on the outside of your jacket or lead apron near your head and neck. This badge contains a piece of X-ray film that is periodically checked for X-ray exposure. A cumulative total is kept on each individual's radiation exposure. A sudden increase in the radiation readings on a badge might indicate faulty equipment or techniques are being used. Remember, the badge does not protect you from being exposed to X-rays, it only monitors your exposure to be sure you're not being exposed to dangerous quantities of radiation. Next, we'll discuss the various components of the X-ray machine. There are hundreds of different machines in use, but fortunately they all contain the same basic components: the tube, the film and cassette, the tabletop, and the generator or transformer. The tube is where the cathode ray tube is housed. It is usually positioned directly over the table and emits the X-ray beams straight down toward the table. The distance between the tube and the tabletop or film is adjustable, but it is often kept at about 40 inches. The tabletop, as you might guess, is where the animal is positioned on top of the X-ray film. The X-ray film is enclosed in a light-proof case called an X-ray cassette. This protects the film from the visible room light. Most contemporary cassettes are lined with special intensifying screens. These screens are impregnated with chemicals that fluoresce when struck by X-rays. This allows an image to be made using much lower X-ray exposure energy. Screens, especially the high-speed and rare earth screens, will enhance the exposure as much as 20 times. This reduces the scatter and makes it safer for everyone involved. The cassette is placed on the tabletop when radiographing small structures, or in a bucky tray or cabinet grid beneath the table when shooting larger objects. The bucky tray holds a grid in the table that traps the scatter radiation. This scatter radiation would cause a blurred image if it struck the X-ray film. With more body mass present, there is more scatter radiation that strikes the film and distorts the image. It is important to correctly position the bucky tray so the grid and cassette will be centered under the X-ray beam as determined by the collimator light. Grids can also be incorporated into a cassette or placed directly on top of a cassette to achieve similar results. Using a grid or a bucky will require an increased exposure of X-rays since not all of the X-rays will get through the grid. Because X-rays are part of an animal's medical records, they must be labeled with the patient's and owner's information, the date, and the hospital where the X-ray was taken. One way this is accomplished is through the use of a radiographic ID marker or radiographic tape. When placed on the cassette prior to exposure in an area not obstructed by the animal's body, they will produce a permanent ID on the film. Right and left markers should also be used to make the records accurate. All of the patient's information may also be light flashed onto the film prior to its developing with a light flasher system located in the darkroom. The power supply for generating X-rays comes from the transformer. This unit is generally large and may also be combined with the control panel. On some units, it is built right into the tabletop. It is here we turn the X-ray machine on, and it is here we adjust the settings for each film we wish to take. There are three basic variables in setting an X-ray machine: the milliamperage, or mA, the kilovoltage, or kV, and the time of exposure, or seconds. Though there are often a wide assortment of knobs and switches, if you can locate these three controls and understand what they do, you're on your way to producing quality X-ray films. Let's begin with the milliamperage, abbreviated mA. Milliamperage is a measure of the quantity of electricity being used to take an X-ray. Most veterinary hospitals work with 100 to 300 mA machines, with the 100 mA machine having more power. The kV is a measure of the voltage being conducted across the cathode tube. Adjusting the kilovoltage allows us to alter the penetrating power and contrast denoted on the film. Contrast is that variation in gray tones that allows an image to become more apparent to the viewer. And finally, the exposure time. Limiting the amount of time the exposure is actually occurring limits the number of photons actually striking the film. Shorter times of exposure mean the animal's movements are less likely to blur the image. All of the specific X-ray machine settings have been calculated and should be available to you on a technique chart. This chart gives you the appropriate settings for the size and body part being X-rayed. Begin by measuring the body part to be X-rayed with special X-ray calipers. In this case, we measure the lateral abdomen to be 9 centimeters across. Next, we find the appropriate technique chart for X-raying the abdomen. This particular technique chart tells us to set the mA at 100, the time of exposure at 1/40th of a second, and finally the kV at 68. Turn the main power switch on and set the mA to 100, and the time to 1/40th of a second. In order to arrive at the appropriate kV setting, you may have to adjust two controls to arrive at the exact setting. First, adjust the major kV setting. This usually moves the readout approximately 10 kilovolts with each turn. Then adjust the minor kV setting. This will bring us to the desired kV setting. Accurate measuring and setting of the X-ray machine will help produce quality films the first time, minimizing unnecessary re-exposures. It is necessary to always set the mA prior to adjusting the kV, because mA changes will affect the kV. The appropriate size film cassette should be loaded and placed on the table or into the bucky tray as determined by the technique chart. The collimator light is turned on near the tube and adjusted to fit the film cassette. It is important to remember that a large exposure area may create an increased amount of scatter. Therefore, the beam should be reduced once the animal is properly positioned to reduce scatter radiation and improve the final image. It is a good safety practice to always have an unexposed margin visible on the film. This provides proof that proper collimation was used, thus avoiding unnecessary exposure of the patient and personnel.